Well, schools in Maine are seeing more students taking advantage of health clinics on school property.
Some districts have school-based health centers, meaning students can get medical, dental, and mental health care right down the hall from their classrooms. In South Portland, the district superintendent says between last year and the year prior, they saw a 59% increase of just medical visits alone. News Center Maine's Sam Olson shows us why school staff says it's more convenient for parents and for students.
This room in South Portland Middle School is where health practitioners meet with students for their appointments. It's called a school-based health clinic. Superintendent Tim Matheny calls the partnership with Greater Portland Health a game changer.
I think it's an exciting partnership because a student's wellness is intimately connected to their ability to learn.
Students can get their sports physicals, immunizations, dental exams, and more, including mental health care, all without ever having to leave the building.
And when they're healthier, they can learn better when they don't have those obstacles in their way.
Matheny says health practitioners conducted more than 1,200 medical visits at his schools last year, while there were about 400 mental and dental care visits apiece.
And when they're healthier, they can learn better when they don't have those obstacles in their way.
If a kid doesn't have any transportation, but they get bused to school, they could see the doctor at school.
Peekaboo Mower is a mental health provider for Penobscot Community Healthcare. PCHC works in Bangor and Brewer school districts and RSU 34.
I've heard nothing but just gratitude from families when they're calling. They're like, "Oh, I'm so thankful."
She says many parents see wait lists as long as 9 months to get their child the mental health care they need. But using the in-school service helps them see a provider faster.
Because I want other school districts to see what can be done.
Matheny says South Portland also has seen a surge of asylum-seeking families who don't necessarily have convenient access to health care. He says for kids wanting to play a sport, for example, the low barrier access to a sports physical in their school helps them get onto the field.
It just lowers the obstacles to kids being a full part of the community.
The superintendent says about 60% of students who use the clinic are multilingual, while about 40% grew up in the U.S. He says the school-based health clinics serve a cross-section of their students to help all students be healthier.
Parents send their kids to our school district hoping they're going to be well cared for.
All under one roof. In South Portland, Sam Olson, News Center, Maine.
The superintendent says Greater Portland Health now has an optometrist on staff who's held some clinics in schools as well.